Hello, my name is Terry Pratt, and I'm going to be the instructor for this Cervical 2 course that you're taking through the North American Institute. What we did in Level 1 courses, or Cervical 1, is that we went through all the safety and scanning and screenings and showed you a lot of treatment for acute patients. When we get into Level 2, we're going to go a little bit more detailed into the anatomy of the cervical spine. We're going to look at detailed biomechanics. We're going to look at the biomechanics particularly of the upper two joints, the AO joint and the AA joint. These areas are commonly needed to be treated since 50% of the rotation in the spine occurs at this level. So we're going to go into the detailed neuroanatomy of the trigeminal nerve. We're going to look at the detailed biomechanics and show you muscle energy techniques and manipulation techniques in order to address this region. We're going to look at safety factors as well when we're looking at the vertebral artery and any of the cervical arteries, because that is a concern when you're looking at manipulation. So we're going to show you ways to screen this and to address it more comfortably. In the middle cervical spine, we're going to look at the biomechanics again and show you different locking techniques in order to make you more efficient in the clinic at dealing and working around different areas that might move a little bit more or move a little bit less. We're going to look at also further advanced neuromuscular re-education treatment in order to carry that over. We're going to look at the effect of some of the respiration components and how that affects the neck, and also how collarbone position affects your neck position. So we're going to have 2 days in the lab and a wonderful online component. In the online component, we're using primal pictures, which is going to show you some three-dimensional anatomy so that when we go to stress test the ligaments of the upper cervical spine or the middle cervical spine, you'll have a better idea since we don't have a cadaver lab handy like we did when we were in PT school. So it's going to be a fun 2 days. It's going to be a lot of hands-on activity, and the online component, I strongly suggest that you dive right into it so that when we show up on day one, we can start with some case studies and get right into the lab. Thank you very much for taking my course.